Obviously, the immediate necessity for remote working was because of the COVID crisis. We realized very early on that you need the ability to manage the calls that come into the practice remotely. One of the biggest issues we found was sourcing laptops, because there was an issue with stock everywhere. So through Amazon, we managed to get 6 new laptops. But we also reconfigured 3 MacBook Pros and installed Parallels and Windows on top of them. So this has had a significant impact on the working life of all staff. For instance, we've got a doctor managing a full list from home because of childcare needs. Children were sent home from school when the school shut down. And so she's able to remotely manage patients, a whole telephone list. If she knows that there's staff at the practice, if that patient needs a face-to-face review, that patient could be booked in with one of the other doctors at the practice. And she's able to manage all of her workflow, including referrals through DXS, for instance. Phone calls are transferred to her via the UC Connect solution. And that really gives, AccuRx, EMIS, DXS, and the UC Connect all in one on a laptop. With the admin staff, one of our receptionists who's self-isolating organizes the repeat prescriptions and medicines management. And she checks the generic practice emails where patients email in. Working from home, she's saying that she's able to do this more efficiently, probably because other staff aren't around disturbing her. Plus also, she has a 1.5 hour travel into the practice. And that's a significant saving for her. Plus, I think it's helped reduce her anxiety, particularly about using public transport with the COVID crisis. Moreover, her family are reassured that she's at home and not sort of coming home and going via public transport. The staff within the practice who are coming into the practice, they've sort of been freed from their desks, if you like. So they can answer the phones when they're in any part of the building if they carry their mobile phone with them. And they're not particularly tied to any desk. If they're looking for any particular file or information in the filing room, they're able to answer the calls. And one of the biggest problems we used to have at the practice was patients having difficulty getting through to the practice. And now, because the system is able to sort of monitor the call rates, the pickups, which extensions are being picked up quickly, the staff are always keen to sort of get to those calls first. Literally 1 or 2 rings of the phone, and it gets answered very quickly. For patients, that's, I think, is a significant impact because previously, as the phone lines were really busy. Our practice used to, up till about 2 weeks ago, have 80% of our patients just walk in without an appointment. And this was why it was very difficult for us to implement fully online consultation tools, because patients would be able to just come to the practice and get seen. So you can imagine there's very little triage. And there's been like this for the last 30 years. Patients and families have got used to the system. We know that majority of patients have access to smartphones, but essentially first thing people do is pick up the phone and ring the practice. So we sent off multiple SMS messages and changed our website and some bit.ly links to the online consultation tools to see if we can get traffic moving into that route. So if you imagine, we have now about 150 to 180 appointments, and these are of course including those patients who are being called proactively, who have been identified being at risk or vulnerable from COVID-19. 30% of our appointments are being booked via an online app, and we're sending texts out to others who aren't using that way of booking appointments, to SMSs, to encourage them to use this via the NHS app and other patient-facing triage apps. And those patients who don't have the technology, so we have, or actually don't understand how to use the technology, we've got a proactive practice manager who helps them set up their device. And we're also proactively identifying those patients who don't have a mobile phone number and an email to flag these patients so that we can ensure that they know that they can still call the practice. My staff and I now feel that this is going to be the future of working in primary care.